Mr. President, over the last few days, 3 Republican senators have publicly stated that they will vote against the health care repeal bill that may come to the Senate this week. In announcing his opposition, one Republican senator, John McCain of Arizona, issued the following statement, and I quote, "As I've repeatedly stressed, health care reform legislation ought to be the product of regular order in the Senate." Last night, Senator Susan Collins, Republican of Maine, stated, and I quote, "This is simply not the way we should be approaching an important and complex issue." She went on to say, "The fact that a new version of this bill was released the very week we're supposed to vote compounds the problem." Mr. President, this should be the end of the Graham-Cassidy repeal debate. Republican leadership should finally scrap this one-sided effort to literally change the health care system for America. There was a hearing yesterday, the only hearing on the bill we're about to vote on. It was a lengthy hearing, but frankly did not entertain all the witnesses or any amendment process so that members could really have input into the bill we're going to face. The Congressional Budget Office is supposed to tell us what this critical legislation will do for America. They issued a preliminary finding yesterday that millions of Americans would lose their health insurance and that those with pre-existing conditions and their family, if they could buy insurance, would find it very, very expensive. At the end of this week, funding for our nation's community health care centers will run out, as does funding for the Children's Health Insurance Program. Shouldn't we be focused on those programs, reauthorizing them appropriately in a timely way? And let's allow the HELP Committee, which is the committee of jurisdiction when it comes to health care, to do their work. I have faith in 2 senators, one Republican, one Democrat, to do the right thing on this. Senator Lamar Alexander of Tennessee, a Republican. Senator Patty Murray of Washington, a Democrat. They've proven before they can take complex issues like federal funding for education and find a bipartisan compromise. What would America say if we announced at the end of next week or even this week, we have a bipartisan compromise to make health care stronger in the United States. It's going to pass the Senate. We're going to send it to the House. We're going to get something done this year in the United States Senate. Well, first, most Americans would be amazed, skeptical, as they should be. But if we can prove that we are going to do it, they would applaud us for finally reaching a point where we do something on a bipartisan basis. That was a process that was underway until last week. Senator Alexander was given orders by the leadership, step back. Let's vote on Graham-Cassidy. Don't do anything more on a bipartisan basis. Well, this is the week for that vote, and I hope it's the week where that vote ends in a basic defeat of the approach and a return to bipartisan compromise and bipartisan negotiation. I don't know what it will take for the Republicans in the Senate and the House to end this never-ending crusade against so-called Obamacare. They have voted 50, 60, 70 times. We know how they feel about it. But the American people have said to them, it isn't enough to oppose Obamacare. Give us a better alternative, and that's where they've stumbled each time. Over the weekend, rather than making improvements to fix what's wrong with their bill, many Republicans doubled down with secret meetings, negotiations, incentives that were built in to the newest version of the bill. The latest Graham-Cassidy repeal measure would slash fundings to the states, decimate the Medicaid program, eliminate protections for people with pre-existing conditions, and basically throw our entire healthcare system into chaos. A few special changes were made for special states, but the changes that came to Graham-Cassidy in the closing days have not really changed the fundamental problem with the bill. It diminishes Medicaid coverage. Medicaid is the health insurance program which most people say, well, that's for the poor people of America. To some extent, that's true, but it's reached far beyond that. 2 out of 3 senior citizens in nursing homes and other institutional settings rely on Medicaid for basic health care. If the cutbacks in Medicaid take place that Graham-Cassidy calls for, what will these seniors do? What will you do for mom, for your grandmother, for your grandfather, when it reaches a point where they can't any longer count on Medicaid to help them pay their medical bills? Will American families have to step up with their own savings? Will they have to look for alternatives to the settings where their parents and grandparents are in today? That's the stark choice which Graham Cassidy will create for many families across America. No one has had time to properly review this latest proposal, in large parts because it's been drafted behind closed doors, no input from experts, no support from the medical community. You would think, after saying it over and over again, that the Republicans would challenge the following statement: there is no medical advocacy group in the United States of America supporting the Graham Cassidy bill. It's a case in my state. Illinois Hospital Association, doctors, nurses, surgeons, pediatricians, community health, all opposed to this bill, every single one of them, as they were to the previous versions. It says something when the bill to change America's healthcare system is opposed by the people who provide healthcare to America. All of them oppose it. It's that bad. Republican leaders want to force a vote this week. Well, if that's what it takes, then we have to move to that vote. But I wish they'd save some time. I wish they'd move to this bipartisan negotiation, which I referred to earlier. The Congressional Budget Office is a nonpartisan agency that's supposed to measure the impact of legislation. So before we vote on it, we know if it's good or bad for the nation, for the people we represent. Here's what they told us last night in a preliminary review. They haven't had time to review this bill in its detail, but in a preliminary review, the CBS told us, and I quote, the number of people with comprehensive health insurance would be reduced by millions each year. How in the world can we as senators make a proposal for the United States of America, which we know will take health insurance coverage away from millions of Americans, exactly the opposite of what our goal should be? The CBO went on to say, federal spending on Medicaid would be reduced by about $1 trillion. Well, there's some Republicans, fiscal conservatives, who say we've got to stop the growth of this program, but none of them, not one of them, can address the fundamental issue: who will then take care in paying for the delivery of babies to low-income families? Half of the children born in my state of Illinois are paid for by Medicaid. Their moms are taken care of until the moment of birth by Medicaid. What will you replace that with if you eliminate Medicaid funding? What about the disabled who count on Medicaid as their health insurance? If you are blind or face a serious disability, Medicaid is the answer for basic health insurance for you. If you're going to cut back $1 trillion out of Medicaid, what will you say to those disabled Americans who want the same peace of mind of health insurance that we all want? School districts all over Illinois and all over the nation receive Medicaid funds to care for special ed students, counselors, transportation, even feeding tubes. If you take the money out of Medicaid, what will we do for those school districts who are trying their best to give kids a fighting chance, even those with serious disabilities? That's the reality. CBO went on to say, coverage for people with pre-existing conditions would be much more expensive and could become unavailable for many more people. This Republican proposal takes us back to that moment in history when health insurance was so expensive, so hard to find, and almost impossible for those with pre-existing conditions. Why would we ever want to go back to that? There's hardly a family in America that doesn't have someone they love, part of their family, with a pre-existing condition. And let me remind those who don't have that circumstance, you are one accident or one diagnosis away from being part of this class of Americans who want health insurance even though their health has not been perfect. In sum, this bill does not do what its authors say it will. They like to tell the American public that states will magically be able to cover the same number of people, provide the same level of benefits, with billions of dollars less in funding. The governors, Democrats and Republicans, have stepped up and said, this is ridiculous. We can't be asked to accept the burden of health insurance for generations to come while the federal government continues to cut the money that's necessary to provide that protection. The CBO rejected the claims that are the basis for this Republican bill. Since Republicans refused to wait for the CBO to complete its full analysis, We've asked outside health experts what they think the impact of this legislation, which is before us this week, would be. Here's what they say. Within a few years, this bill would likely rip health insurance away from more than 20 million Americans, including 1 million people in the state of Illinois. A state of 12.5 million people that I represent would lose health insurance for 1 million people because of this Republican proposal before us this week. The average 60-year-old person in Illinois would see their health insurance premiums increase by $11,700 a year. Almost $1,000 a month, health insurance would go up. Why? Because they change a basic formula. In the Affordable Care Act, we see the disparity in premiums charged between the highest and lowest will be no more than 3 to 1. They changed the number in their Republican bill to 5 to 1. It means those over the age of 50 and under 65 are going to see premium increases estimated at almost $1,000 a month. By 2026, Illinois would see its health care funding slashed by $8 billion. By 2036, this number would soar to $153 billion. Medicaid, covering half of all children in Illinois, 2 out of 3 seniors in nursing homes, would be devastated. And the Medicaid expansion, which helps us in Illinois combat the opioid epidemic, provides coverage for 650,000 Illinoisans, and brings stabilities to our hospitals all across the state, would be shut down. Here's what the Illinois Hospital Association said about this bill. Illinois cannot absorb additional financial burdens and will be forced to reduce eligibility, covered services, and payments to providers. The magnitude of these cuts and changes to Medicaid is staggering. That's from the Illinois Hospital Association about this Republican bill. And let's review what this does to people with pre-existing conditions. The Republicans say this is all about giving flexibility to states. We hear that over and over again. It sure sounds nice until you realize that's a code word for massive funding cuts and the elimination of basic health protection. In the name of state flexibility, this bill would allow insurers to charge those with pre-existing conditions sky-high premiums the moment they got sick. State flexibility under this bill means reimposing annual and lifetime limits on patients, including infants born with serious medical problems. State flexibility under Trump Care means charging Americans over age 50 up to 5 times more than younger people. That's exactly why the American Association of Retired People, AARP, has steadfastly opposed these Republican changes. State flexibility to my Republican friends means tossing out essential health benefits, the guarantee that your insurance covers the basic services your family may need, prescription drugs, maternity care, mental health and addiction treatment. I spoke to one of my Republican colleagues the other day and said, what are you driving at here? Are you saying that we can reduce the cost of health insurance if we give people the option of saying they won't buy coverage for mental illness and substance abuse treatment? He said, yes, that's one thing they could do. I said, and then what happens next month when you discover that your daughter, a sophomore in high school, is now taking opioids and may move to heroin next? You want to intervene, you want to do it, but now you have to pay out of pocket because you didn't buy that essential coverage of mental illness and substance abuse treatment. It's a short-sighted gain to reduce premiums and to give up basic essential benefits, but that's what the Republicans propose. That's why this measure is opposed by every major medical provider and patient organization nationwide. AARP, the American Hospital Association, the American Medical Association, the American Academy of Pediatrics, nurses, disability groups, the American Heart, Lung, Diabetes, Alzheimer's, the list goes on and on. But guess who also came out in opposition to this bill? Insurance commissioners and Medicaid directors. These are the officials who would actually have to implement these cuts. They agree with the Congressional Budget Office, saying you can't slash the health care budget by 20, 30% and expect states with, quote, flexibility, close quote, to make up the difference. The bipartisan association represented every Medicaid director in the country, every one of them, stated that Medicaid cuts would, quote, constitute the largest transfer of financial risk from the federal government to the states in our country's history. Show me a state that can cover as many people with the same benefits if a third of the money is taken away. That's what the Republican bill does. Here's what Governor Sandoval, a Republican governor in Nevada, said, and I quote, "Flexibility with reduced funding is a false choice. I will not pit seniors, children, families, the mentally ill, hospitals, care providers, or any other Nevadan against each other because of cuts to Nevada's health system proposed by Graham Cassidy." This is a Republican governor speaking in the same clear terms as governors of both political parties about the impossible dilemma that would be created by this bill. Mr. President, enough's enough. The law that we passed, the Affordable Care Act, helped 20 million people get health coverage. People with pre-existing conditions were finally protected. Women are no longer discriminated against when it comes to health insurance. Americans get free preventive health care like cancer screenings. Is it a perfect law? Not by any means. For the 3% in the individual market, we need to do better, and we can. We need to improve that market. First, the Trump administration must do its best to help us, not hurt health care in America. If they are setting out to sabotage this health care system, they can do it, but I hope they won't. The president won't suffer if they do, but a lot of innocent American families will. It'll make it harder for people to enroll in insurance groups. It'll slash funding for outreach. It'll actively discourage insurers from offering health plans to individuals. Mr. President, I'm going to yield the floor to the Democratic leader here. And in closing, I want to say two things. First, I'd like to ask consent that the September 22nd, 2017 article in the New Yorker by Dr. Atul Gawande be entered into the record at this point.
Without objection.
Thank you. I'd like to ask consent that a statement from A.J. Wilhelmi, President and CEO of the Illinois Health and Hospital Association, be also entered into the record.
Without objection.
And finally, that a statement by the National Association of Medicaid Directors, which I referred to, be entered into the record in its entirety.
Without objection.
What America wants is for us to solve problems, not create it. The Graham Cassidy bill will create problems for every American family. Let's do something right. On a bipartisan basis, let's sit down and work out improvements to our health care system. Let's stop the partisanship when it comes to health care. Let's come together now. We've each got our grievances against one another, one party or the other. American people are tired of grievances. They're expecting us to do something positive. We can do it. Let's return to the bipartisan negotiation process. I think that Senators Lamar Alexander and Patty Murray, Republican and Democrat, can lead us to a good path to strengthen our health care system. I yield the floor.